Hej och välkomna till Malmö Adventkyrkan. Ni som tittar där hemma, ett extra stort välkomna. Följande möte kommer att vara på engelska för att vi ska nå så många som möjligt. Men i efterhand kommer det också vara möjligt att sätta på svensk undertext automatiskt. Welcome to the Adventist Church here in Malmö. We have just had Health Expo here behind us. And this will be followed now by a lecture on diet and cardiovascular disease and how you can actually reverse cardiovascular disease. It's one of the top killers these days, and we're passionate about this subject. We have with us Joachim Broegaard, doctor from Denmark, and he'll tell you a bit more about this. So we're so happy that you're joining us online and here in person. Thank you.
Mm-hmm. Yes, good evening. It's nice to have the opportunity to be here and share about my passion for what we can do with lifestyle for different diseases. And tonight the topic is on heart disease and how can we reverse heart disease. Why should I have an interest in talking about heart disease? And well, first of all, I think because I'm a medical doctor. So most every day I talk to people that have heart disease, hypertension, high cholesterol, that may have had a heart attack, and may have angina. Secondly, I have a high risk for developing heart disease myself. First, because I'm a man. So if you're a man, you automatically have a higher risk than if you're a woman. Secondly, because my grandfather on my father's side, he had angina for many years. And when he was 69, he died of a heart attack. He was riding his bike through the little town where I grew up and suddenly just died on the bike and from heart attack and fell. So my dad, when he was around 50 years old, was diagnosed with coronary artery disease and had a little device put in that can open up the artery again. He has high blood pressure, he has high cholesterol. My grandmother on my father's side, she died of a stroke. That's also included in when we talk about cardiovascular disease. My grandmother on my mother's side, she also had vascular dementia. So I'm at risk of developing this myself. So that's some of my background. So I have a big interest in this topic. Let's start by looking at high blood pressure and the risk factors for high blood pressure. Have to remember to change here. Yes. What is a normal blood pressure? Well, we say if you go here to our expo and you get your blood pressure checked, it should be at least under 140/90. But the average blood pressure when you take it at home should not be more than 135/85. That's at least the recommendation in Denmark. I think it's pretty similar to here in Sweden. What are risk factors? Like I mentioned before, hereditary, the genes, genetic. I'm disposed to get high blood pressure because of my genes. Also, if you're overweight, that's another risk factor. Higher alcohol consumption. There are some more risk factors also. Also, if you have a sedentary lifestyle like most people have, they don't move around like in old days when you worked on a farm, you had hard work, you were moving around all the time. Today, most of us, we sit on a chair or we sit at the computer. So we have seen we've looked at some risk factors, but what is the real cause, and we will look at that also in this presentation. What are some of the facts about high blood pressure? At least 1.8 million, I just checked this up, that is for Swedish, the land of Sweden, have hypertension. And that's maybe not including all the ones that walk, that we meet, that we could imagine that don't have the diagnosis, but still are walking around with high blood pressure. The proportion increases with age, so the older you get, the higher risk for high blood pressure, and also the prevalence of people with high blood pressure will increase. Often there are no symptoms. If your blood pressure get above maybe 180 or 200, maybe you start feeling a little dizzy, maybe you start feeling headache. But some people walk around with a blood pressure of 200 and they don't feel anything. The problem is that it increases the risk of heart attack and stroke. It's kind of like if you have it can be any kind of liquid circulating within a closed, what can we call it, a closed loop or a closed circulation. If you increase the pressure, you also increase the risk of the water pipe breaking, or you increase the risk of what you call the friction. It's after a while it will destroy the pipe. So, what can you do for treatment? Well, first of all, if you're smoking, you need to stop smoking. Alcohol, it's good to reduce. Exercise helps the body to produce its own blood pressure medication. That's why if you go to a doctor, they tell you to exercise, exercise, exercise. Exercise is important. Tonight I will not talk so much about exercise because diet allows the body to produce the medicine also. I'll show you what kind of medicine it is the body can make by itself. Also, weight reduction is very important. So what kind of medication can you get to decrease the blood pressure? I have put here some kind of closed a closed loop here. This is a little system where there's some fluid running within the pipe. And like I said before, if the pressure here increases, the risk of rupture, the risk that something goes wrong here, is very high. And there is increased, what you call it, friction and wear and tear on the inside of these pipes. Can you understand this? The higher the pressure, the more wear and tear. It's like when you're doing like this. After a while, you will destroy the skin if you continue doing like this. That's the same if you have high pressure inside this circulatory system. So what can we do here? Any suggestions? If we want to lower the pressure in the system, there are several things we can do. We can turn down the pump. Would that be a good idea? If we reduce the effect of the pump, that could be one way to do it. We do that with some medication called beta blocker. Maybe some of you know this, are using that yourself. There's another way to do it. We can actually open up here, this stricture here. So we can do that with several blood pressure medications, calcium channel blockers, ACE inhibitors, and AT2 antagonists. That's another way to do it. Do you have other suggestions? What else can we do? We can take out some of the liquid. Here, maybe open up. We do that with diuretics. They make you go more often to the bathroom. But I have another suggestion, and that is diet and exercise. Diet and exercise reduces a little bit the pump, so it doesn't beat so fast, but mostly it is helping to open up this pipe here, or this blood vessel. So that's what we'll also look at. Now I forgot to look at what the clock was when I started. Anyone here that were looking at the clock? When did we start? We just go on. Yes, you give me a sign when I should try to wrap things up. So let's look at ischemic heart disease. And ischemic heart disease is this kind of heart disease where you have lowered flow of blood to your heart muscle. Heart disease is a term that covers a lot of different things. You can have a problem with your heart valves and so on. You can have maybe some people were born with heart disease. I'm not going to touch this at all. We're going to talk about ischemic heart disease. In normal English language, that means the narrowing of our blood vessels. And in this case, it's a narrowing of our blood vessels that supply the heart with blood. We'll look at some facts, the prevalence, what it is, the cause, and what we can do to treat it. For Sweden, there are more than 2 million people living with heart disease. So again, this is the term covering all the heart, or this is the statistic covering all kind of heart diseases, but a majority of these 2 million or more than 2 million, that will be ischemic heart disease. Another word for this is atherosclerosis, difficult word. 30,000 deaths per year due to heart disease. That's not a small number, that's a big number actually. And a majority of this will be due to ischemic heart disease. Then there's 1/3 of heart attacks occur in the age 20 to 69. That's not high age, I would say. So there's a risk that all of us here in this room could get a heart attack. And 1/3 of deaths from heart attacks also happens in this age, between 20 and 69. So it's something that we all need to be thinking about, and we all need to try to see how we can improve our health and our diet and our lifestyle. So what is the ischemic heart disease? Yes, we narrow it down to what we call ischemic heart disease or atherosclerosis. What does that mean? Let's see if we can break this word down. Atheroma in the original language in the Greek means porridge. You know, like when you make oatmeal at home, sometimes can get like a sticky thing, maybe some thick sticky thing. So imagine you have a pipe and then you put a thick porridge. That means the liquid cannot flow so much. That's what you see here also. It's a big sticky kind of porridge sitting on the inside of the blood vessels of the arteries. It's a deposit of minerals, mostly calcium. That's why we call it in Danish åderförkalkning. It's also cholesterol that is sitting inside, and other components. There are white blood cells and so on also. Let's look at this one here. When do we start to feel sick? Is it down here when it starts building up? Or when do we start feeling symptoms of heart disease? Any ideas? You're thinking here?
No, the other one.
This one? Yeah, that's a very good suggestion. Actually, it's a silent killer. And in 1/3 of all cases of heart attack, you don't feel it until you're dead, and then that means you don't feel it. Okay? So maybe you start feeling it when there's only 20% of the passage left. So most people don't feel it, and suddenly so for those that do feel it and have the chest pain and they make it to the hospital in time, that's very good. because many won't feel it. So the thing is, if you have a clogged artery in the heart, we call it atherosclerosis, a universal disease. That means if you have a narrowing of the artery in the heart, it's most probably also in the brain and also in your leg and in the rest of the body. So again, that's to show that it's only, come and see, when you maybe have 20% left of passage through the artery, that's when you start having symptoms. When does heart disease start? We saw that actually heart attack can happen to people from 20 to 69 in 1/3 of the cases. But when do you think it starts for most people? Is it 50 years old or 60 or older? We kind of gave it a little bit away because we said it can happen even from 20 years. Can heart disease happen in people younger than 20 years? This narrowing of the clogged arteries filled up with calcium and cholesterol. Someone was nodding, yes?
It depends if they eat like constantly fast food or something like that.
Yes, depends on lifestyle. It depends also on genes, and it depends on what your parents were eating. When your mom was pregnant, how high was her cholesterol? Doesn't mean that heart disease starts in a fetus, but it means the fatty streaks. That's something that comes before the plaque inside the artery. Should be here. So they make some studies to show that the risk for heart disease increases if your mother during pregnancy or even before. This is before pregnancy. If she had high cholesterol, that increases your risk. There's a
So it's not only during not only during the pregnancy, it's also before.
this study was about before pregnancy, yes. So even in fetuses, they have seen these fatty streaks, this starting of deposit of cholesterol on the artery wall. That's amazing, isn't it? So if it starts so early, we should also start preventing, and the best way to prevent is also to start for mothers before they get pregnant to start, and also, of course, during pregnancy. What are some of the symptoms? Yes, the one that angina we talked about, that's one of the symptoms, and that's when the most narrow part of the arteries, that's when it's in the heart. Sometimes it's also can be a heart attack when this kind of plaque is unstable and suddenly ruptures. That gives a heart attack. Impotence. There are many men, older gentlemen, that have impotence. And sometimes it starts in the 30s, 30, 35, 40, 45, 50 years. Then come to me and ask, can you help us with some Viagra? You know this. It has other names. I prescribe those that are cheaper, but I have a much better medication for you tonight than taking pills to help with your impotence. But it's an early sign of atherosclerosis and narrowing of the arteries in the body. Pain in the legs, it's a special disease called claudication, when the arteries in the legs, they get clogged. Let's do the other one here first. It can sit in the brain. That's called vascular dementia. You start to be very forgetful. There are also other causes, but this is one of them. And then some people have this in the stomach and intestines, that they get very painful after they have eaten. I should say there are other causes of that also, for other causes for stomach pain. But some of the symptoms here. So where should cholesterol levels be? I know that there are physicians and scientists saying the exact opposite of what I say tonight. But I have seen patients that have been helped with the cholesterol and with the lifestyle and with diet. And it's actually, this is what I've experienced, and this is what I believe is the best way to do it. That's why I present this to you tonight. So target cholesterol, what should it be? We say normally it should be less than 2.6. If you already have heart disease, if you already have a stent in your coronary artery, or if you've already have had a heart attack, or have angina and have the symptoms and so on, then your cholesterol has to be lowered a lot more in order to reduce your risk. That is your LDL cholesterol. So what increases, what are risk factors? Your genes, if you're male, if you have higher age, smoking, high blood pressure, and so on. What is the difference between the cholesterol? I won't go into the details, but we have the good cholesterol and we have the bad cholesterol. The LDL is the one that is able to go into the artery walls and create problems and lead to atherosclerosis. This is, again, narrowing of the blood vessels. The bad, I think I wrote it opposite. The bad cholesterol is the top one. So please notice this. It should be the bad cholesterol, LDL. So just forget what I wrote here. Listen to what I say. Bad cholesterol. This is good cholesterol. And in Danish, it's so easy to remember because we call it det lede kolesterol. I don't know if you have a word for that in Swedish and English. And here, det herlige kolesterol, det gode kolesterol, which helps to eliminate the bad cholesterol. So please just ignore the mistake here. So when you have had this for a long time, we saw the other picture where it slowly builds up over years within your arteries. When this happened to one of the arteries, coronary arteries that are supplying blood and oxygen and other supply to the heart muscle, when that narrowing is going on here and suddenly the plaque is rupturing and it's creating a complete blockage, then you have what you call a myocardial infarction. That's when the blood supply here to this part of the heart stops. And if it's not treated within a short time, then the heart muscle dies. And this, we call it a myocardial infarction, is when the heart muscle is damaged or is dying. And in many cases, it's very dangerous when it goes so far, when it comes to that point. I will show you another picture of a blood vessel. This down here is a healthy blood vessel. All the little red, tiny, circular points or dots you see here, those are red blood vessels. Outside of the, not blood vessels, sorry, blood, we call them, in English, I forgot the word. Anyway, we have white blood cells and red blood cells. Here we go. All these dots are red blood cells. Outside of the red blood cells, we have the vascular wall. This is made up of a different cell layers, but also of muscle tissue. The thing is that blood vessels, they have the ability to contract and they have the ability to relax. So when you have a healthy blood vessel, it can contract and relax very easily. When you have an unhealthy blood vessel, an old one with a lot of build-up of plaque, it gets stiff, and it cannot regulate automatically. So that increases our blood pressure. When the heart pumps, the blood vessels should do like this, be flexible, so the blood pressure doesn't go up. If the wall is stiff and the heart is pumping, then you get increased pressure inside. Anyway, think I have another illustration here. So this one here is a cross-section of this part here. So after some time and build-up of this cholesterol and deposit of minerals, after years it looks more like this here, and at this point it ruptures, and all this porridge, if you can call it this, it rushes into the lumen here, into the little hole that is left, and then we have a blood pressure. If you see these little arrows, they are pointing to cholesterol pieces that flows out and blocks the rest, the little part of the passage that was left. And this is actually a picture of a real blood clot, or you can say heart attack. You know what this is? Any idea? Yeah, this is arteria carotis sitting up here. It's also a unhealthy one, very unhealthy one. Yes, I have. When I was a student, I was assisting in a surgery where they, for some people, they can repair this. They can take out this part here, and you see the white part of this part here. It's hard. It's like when you have these scissors and other instruments that you use, and when you do like this, it's like touching stone. It's hard like stone. Part of this is hard like stone. So you can say actually, surgically you can remove this, and you open the blood vessel, you remove it, and you take it out. But there's another way to do it, and you can actually do it with your diet. It's much better and much less risk. Actually, no risk at all if you do it with the diet in the right way. So there's a lot of risk. There's a high risk with this surgery. Yes, there's another question.
How long does it take to get it back?
You can. I will show you later some examples. It's not going so far for everyone, but normally within 3 months the symptoms will go away if you change your lifestyle. Let's say you have angina, you change your lifestyle completely, then you can maybe within 3 to 6 months you start getting rid of the pain. Yeah. So again, risk factors, it's somewhat covering the same as we talked about, except that here also diabetes is a high risk factor also for cardiovascular disease. There's a question over here. Yeah. The English, the Latin word is arteria carotis. It sits up here, and it's supplying the blood, gives blood supply to the brain and to the head. You can feel it when you feel here. That's the part right here. When you put your 2 fingers here, yeah. So some people say, when you read about it, and many people say, oh, I have heart disease, I have high blood pressure because my dad had it, and my grandfather, and so on. Everyone in my family has high blood pressure, or everyone in my family has high cholesterol. So here, this is not just for high blood pressure, but this is for heart disease. So if we have the genes that causes heart disease, does that mean that we also have to get heart disease ourselves? And they made a study that showed that if you just follow 3 out of 4 health habits, you can decrease your risk in half. And that was not very hard. It was just something that you have to stop smoking, and you have to exercise 1 time a week, and you have to eat healthy. I mean, it was not very much that was required in order to increase your risk 46% if you had the genes. So if we think it's because we are just, it's just life this just happens because that's how we were born. It's not true. We can actually do a lot to decrease our risk, even if we have this in all our family. There's another way maybe we can decrease our risk. In the Old Testament, we find this saying of Yahweh. He was saying to the Jews in the Old Testament, if you listen carefully to the Lord your God and do what is right in his eyes, if you pay attention to his commandments and keep all his decrees, I will not bring on you any of the diseases I brought on the Egyptians, for I am the Lord who heals you. So the question is, how do we know what kind of diseases the Egyptians had? Well, it's kind of hard to know because they died a long time ago. But the most healthy of the Egyptians, they mummified. And so the thing is that scientists, they have taken out these mummies out of the tombs, out of the pyramids down in Egypt, and they have dissected them, and they have also made CT scans. Now, on a scan, when you get an X-ray or a CT scan, what you can see is minerals. You can also see the minerals in the arteries, and here you can see deposit of minerals in the heart, in the arteries supplying the heart. So this mummy, or this person that lived 4,000 years ago, actually had coronary heart disease. And then the question is, why did they have that? And we can go to the history books and then find out that they lived quite unhealthy. They ate a lot of meat, a lot of dietary fat, and so on. So part of that would explain why they had these heart disease. But in the text that we just read before, we read that Yahweh, he told the Jews back then that if they follow his commandments, then they wouldn't have the same diseases. Well, unfortunately, we cannot go back and in the same way and see what kind of diseases the Jews had back then. But today we have Jews living that are following the same rules that they followed back then. The question is, how is it going for them? And we can see that this is a new study. Almost 2 years ago, they released the study, 2022, and they did this study on almost 10,000 Jewish men. This was a special branch of the Jewish population, very orthodox, but where they adhere very strictly to the special dietary laws that God gave to the Jews. And they found out that they had much less risk of dying from heart disease and also from all-cause mortality than those Jews that were more loose and were more secular and just eating like we eat in the Western type of world. Even though these Jews were not so physical active, actually. And even though they had a higher risk for type 2 diabetes, they still had less risk of heart disease. We can see that here. 40% less heart disease. How can we explain this? The part of the explanation, I think, is because of the way because they were following the dietary rules that God gave to them. So let's see how powerful diet can be for heart disease and for reversing heart disease. Question: can 10 days of dietary change, can that make a difference? We have an example, a case of a female patient She had coronary artery disease, and she was, from one day to the other, she changed completely to a plant-based diet. And in her case, it was no free oils or free fats, and a low dose of cholesterol-lowering medication. And I think we had a question down here: how fast can it go? How fast can we reverse heart disease? Wasn't that not the question? I think that was a question. How fast can it be reversed? So let's see here. After 10 days, was the cholesterol lowered from 6.4 to 3.5. Just 10 days. I have seen the same, but in 5 days. This was 10 days, but I've seen the same in a person in 5 days. Complete change in diet that can lower the cholesterol very quick. For some people, it takes a little longer. Depends how radical you are. Not everyone needs to be as radical immediately, but the point is that you need to progress and make progression and take more and more steps toward this. Another interesting thing is, if we look at this one here, it's a PET scan of the heart. Imagine we look inside my body, we take a cross-section here, and look up into my heart here. Then we would see two rooms, if you so to speak, or two chambers in the heart, two ventricles. One here is the left and one here is the right. This one here is the one that pumps blood out into my body, and this one pumps blood into my lungs. The red color here represents a lot of activity. There's a lot of oxygen supply that can give a lot of activity to the heart. You see, it's kind of not evenly distributed here. This is because this heart is suffering from a lack of blood supply. Then this was when the lady came in with her symptoms or whatever she had. Then 3 weeks after changing to a whole food plant-based diet, we see how much better it looks here. The red color is almost all the way around. Can you see that? So in just 10 days, we had the cholesterol was reduced 50%. After 3 weeks, the heart, the blood supply to the heart was almost totally restored. How can this happen? This does not show that the artery sclerosis or the narrowing of the artery because of the plaque is reduced within 3 weeks. It takes longer time, but this shows another action. This shows another action that goes on in the blood vessels, and I'll explain to you this to you. The question is, can just one meal, can that affect the artery that it cannot open up and make the blood flow freely? Can one meal affect our artery? And it can. I know diagrams can make us fall asleep, so I hope you stay awake with me now. But this was 3 groups of young people that were very physical active. This one here, this line here represents the group. Let me see here. Low fat. This one, they were eating a healthy meal, the one with the circles. And that, because they were eating the healthy meal, the arteries in the body, they worked fine all the time. They were able to expand and contract as they should. Then there is this group of young people that were eating like something that we would call maybe a McDonald's breakfast. And up to 4, 5, 6 hours, it took 6 hours before the ability of the blood vessel to dilate and to widen before this ability was normalized again. And what is the reason? What is the reason for this function of the blood vessel that is inhibited? And we see it actually from here. It was the fat in the food that inhibits the blood vessel from working normally. The whole, the main thing here, if you don't remember anything else from what I said, you have to remember this: nitrogen oxide. NO is the chemical formula. This is the medicine that we need, and the body makes it itself. You can also give it in a pill. When people have a heart attack, we give nitrogen on a spray. Nitrogen oxide on a spray, but the body can create it itself. If you give it the right condition, the body can make this medicine itself. And I will tell you how we can help the body to make it and how we can hinder the body from making this medicine itself. This is a miracle medicine because it can open up the blood vessels. So that when the heart needs more blood, this medicine opens up the blood vessels and the heart gets a freely supply. When the brain needs more blood, when the muscles need more blood, this medicine can open up the blood vessels. It can also stop the blood from sticking together so that we make a blood clot that will cause a heart attack. And it does a lot of wonders in the body. It can even help to reverse the plaque sitting inside the arteries. Inside our blood vessels, outside our arteries, we have this little machine called nitrogen oxide synthase. If we give the right conditions, it will help to create nitrogen oxide. It will help to make this medicine itself. Arginine is an amino acid that is found in many food items, especially in legumes and in nuts. There's another little molecule in our body that is actually competing with arginine in order to form nitric oxide. So when we have much of this in our body, we cannot make the medicine. So if we eat healthy, we tend to have more of this, we will have more of this medicine in our body. How can we hinder this molecule from taking the place and stopping the process of making this medicine? I'll try to not make it too complicated. Anyway, this little machine here can break down this molecule, so we get a lot of medicine, nitric oxide created. But if we have high fat in the blood, that was the McDonald's meal. If we have high cholesterol, we're eating a lot of food with high cholesterol, plus we are not eating fiber. Homocysteine, that's another thing that can hinder this process. Insulin resistance, that's what we have when we have diabetes. Hypertension, that is high blood pressure, and if we're smoking, any of these things can stop us from making our own medicine, can stop the blood vessels from making their own medicine. So that's why the diet is so important here. It makes all the difference. We saw just one meal can affect the blood vessels for up to 6 hours. On the other hand, if we were giving the right conditions, then within just 5 to 10 days, we can lower the cholesterol. And within we saw the picture, 3 weeks, we can increase the blood flow to the heart. How is this normally treated? How is normally heart disease treated? I liken this to this faucet, just this water basin just running over. What should we do? We can do this. Is that efficient? No? What do you suggest? What can we do? We go to the cause of the problem. We close the faucet and we unplug the drain. Wouldn't that be I suggest that that's the best solution. What we do today, we give salicylic acid for the heart, hjärtemagnetyl in Danish. We give statins to lower the cholesterol. But there's a more efficient way, and the more efficient way is to help the body to produce its own medicine, to help the blood vessels to produce its own medicine. The problem here is high cholesterol and something called endothelial dysfunction. That means that the blood vessels cannot themselves create nitric oxide. And that's what we want to do. So how should we treat it? We should get control of the blood pressure and also help the blood vessels to make their own medicine. And that's what I'll try to show here in a study they made some years ago, experiment they made some years ago. They have two groups. One group, they had 100% plant-based diet, and they did not eat any free oils or any fats or anything like that. And then we have another group. They ate what they wanted. They just didn't follow the rules for the first group. And if you want to see the difference, it's quite striking. Within the study period, that was several years, we have less than 10% of cardiovascular events that happened to the study group number 1, whereas over half of there was more than 62% in group number 2, and cardiovascular events is something like, for example, a heart attack. In group number 2, they were not following the diet. That means they ate all the oil and fat they wanted. There was no reversing heart disease. There's actually no medication known to reverse heart. Well, there is one medication, but it's kind of not so healthy to eat. It has some other side effects that you wouldn't want. And it's not being used today because whereas in group number 1, up to 22% they had diagnosed, how can you say, not diagnosed, but they had shown on imaging, they had shown that there was reversal of the plaque in the artery. And I'll show a picture to you later on. In group number 2, they ate as they wanted. Half of them experienced, they got worse with the symptoms, and in group number 1, it was very little percentage. So again, we have already seen what is it that is inhibiting, what is destroying the function of the blood vessel to produce its own medicine in order to work good and be able to expand and allow the blood to flow freely. Oils and fats is always, even if you call it the extra virgin oil, it's still hindering, so we should not use too much of it. And if you have heart disease already, it will be good to completely eliminate it. You also, when I say this, you have to learn also to make healthy food that tastes good. Otherwise, it's not so easy. You have to find a way that you can do it. Fast food, of course, because it has a lot of oil, has a lot of fat, it has a lot of animal protein, has a lot of cholesterol. What helps the endothelial dysfunction? Lots of things. All of this is medicine that you can eat freely as much as you want. All the things that are whole food, non-refined, non-processed, you can eat. This is medicine. This is medicine. Walnut, flaxseed, medicine for your heart, medicine for your blood vessels. Some studies here shows that when you had 30 grams of flaxseed per day, then you had a decrease, 15% decrease in LDL, and you also had a 15 millimeter mercury decrease in the blood pressure. Chia seeds also very good. What is it fiber is doing when it is in the body? Those of you that talked to me when you went through the expo, to some of you I explained here that there are two strategies that you should actually combine them. Two strategies when you want to lower cholesterol. And remember that cholesterol is increasing the risk of heart disease. That's why it is important to lower cholesterol. Two strategies. The one is to lower cholesterol in the food. The best way is to eliminate it completely. There's no cholesterol in plants, no cholesterol in beans, no cholesterol in Brussels sprouts, no cholesterol in kale, in cabbage, in beans, in bananas, and so on. No cholesterol at all. In grains, no cholesterol. In animal products, in meat, white and red meat, cheese, eggs, and so on, you have cholesterol. So you have to reduce or eliminate cholesterol. That's one way. So if you have less or no cholesterol coming in, that's one way. The next one is to increase fiber. Let's say you have a lot of fiber in your diet. It goes down here in the stomach. It goes into the first part of the intestines. Here it's mixed with the cholesterol that is excreted through the gallbladder. Here, the fiber in your intestines absorbs the cholesterol and binds it and takes it out of the body. That's why it is so important, instead of white rice, brown rice. Instead of white pasta, brown pasta, whole wheat pasta. Instead of white bread, whole wheat bread. And the more, the less refined the possible. It's better to reduce cholesterol. Garlic powder is another way to reduce cholesterol, but also blood pressure. Yeah, there's a hand over here. Sorry? Yes? Beans? Like those that are on a can? Canned beans? You're talking about dried beans? I don't think so. I think they're just dried. Yeah. Most beans they're just dried. They have high fiber, very good. Yeah. No, I don't think so. I don't know. Of course, organic is better than conventional. Yeah. Mm-hmm. Fat? Or oil? Yeah. Okay, maybe I should repeat a question for the sake of the camera here. The first question was, dried beans, do they have preservatives? I don't actually know. I think normally when I read on the ingredients, it just says dried beans. And the next question was, how much oil should you have? Yeah, well, when the creator, he made the things, he put things in the package, so he packed avocado and he packed the walnuts with oil, and then when we process them, then we take the oil out, and we take a lot of things out that are very good. We should have it, the best way is in the package. Now, I'm not the one that says you should have no oil. I mean, at least, but I think if you have already heart disease, you already have symptoms. Let's say you have angina, you have already had a heart attack, or you have a stent put into your coronary artery, then I think it would be well to eliminate oil and just have it as it comes in the way it's packaged in the food, the oil that is packaged in the beans and the nuts and the avocado and so on. Yeah. So there's no lower limit to how much oil you should take. just make sure you get it in the food, but you don't need to have it in a bottle of oil and pour it on your food. Walnuts has omega-3, pumpkin seeds, flaxseed, and so on. Yeah, sunflower seeds. Yes, I think my time is up in a few minutes. I think we took most of the questions as we were going through it. Any other question? Just let me know. Can we scientifically say that it is a good thing to eat vegetarian or vegan in order to lower the cholesterol? Yes, it is. If we look at these scientific studies, this is a meta-analysis that shows how the blood lipids are decreased with people that are eating vegan. We won't get into all the small numbers here. It's just to show that it does work and it is scientifically proven. Is that a hand down there? Yeah. Yes, please.
I also recently heard there are two kinds of cholesterols, a good one and a bad one.
Yes, we looked at that, yes.
What is now the main difference? Because I heard that one is with got in contact with oxygen and the other one not.
Yeah. We talked about it, the LDL, and I wrote it wrong, that's why I tried to correct it. LDL is the bad. I mean, we need some of it, we just need to not have it too high. It's not that it's not bad when it's within the normal range, but when it's too high, then that's the bad. Then there's a good cholesterol. We need that to be high. When that's too low, that's a problem. Yeah, and the one that's oxidized is the LDL. Then it turns bad.
The white of the egg also doesn't have cholesterol?
That has cholesterol, and that tends to increase that does increase our cholesterol, at least for most people. If you cannot eliminate it, some people they can eat egg without having high cholesterol. Other can, with other people, they get high cholesterol when they eat egg.
One of the two, like white or yellow of the egg, doesn't have cholesterol.
The white is protein, and the yellow is high cholesterol. Yeah. Okay, let's just shortly look at this one here. That was as far as I remember, it was a physician. He was a physician himself. He was about 40 years old, and he had a plaque or a narrow of the arteries in his of the coronary artery, one of the coronary artery here. He could not have the surgery where you go in and put a stent in for some reasons, and he decided not to have cholesterol-lowering medication. So he went on a 100% plant-based diet, and within 32 months, that's about 2.5 years, if I'm correct, it's completely cleaned up, completely reversed. It doesn't happen in all people, in all that reverse, but they can. The main thing is that you prevent a heart attack. If you can just prevent heart attack, that's the main thing. But for some people, it cleans up completely and completely reverses. That's the effect of plants. You cannot do that with any medication at all. In the end, it comes to the question, is it possible to change your diet? And it is possible if you are aware of it, and if you say, okay, this is what I want to do. I want to help the body make its own medicine. The problem is addiction. Meat is a mild, causes some kind of addiction. Cheese, it causes some kind of addiction in the brain, and that's why it makes it hard to stop. Junk food gives us addiction. That's why it's hard to stop. So, one step at a time, we need to change, get more whole foods, more fiber in the grains, more vegetables in our food, and so on. Yes, so take this home. Hereditary or genes is not your destiny. You can do something about it. Lifestyle I would say including the diet is the main risk factor. And we can reverse heart disease with a healthy, tasty, whole food plant-based diet. I think my time is up. My last word here will be, like King Solomon, he said, keep your heart with all diligence, for out of it springs the issues of life. Thank you for your patience. I hope we covered questions. If there are any more questions afterward, you are welcome to come and talk to me. Yes. Thank you for your time.